The next speaker is Amit Timilsena. He is speaking on integrating gender and sexual reproductive health in local climate policies. Insight from Sudur Paschima and Lumbini province. Dr. Amit, you have only 10 minutes.
Thank you so much. The first presentation rightly sets tone for this presentation as well, and rightly sets the tone for this presentation as well. And with the permission from the session chairs, I would like to start my presentation. The title of the presentation is Integrating Gender and Sexual and Reproductive Health and Rights in Local Climate Policies and Programs. So here are the list of the research team, and we all are affiliated from IPAS Nepal. So this is the presentation outline. Nepal is one of the most climate change vulnerable countries in the world, and the available literature suggests that the climate change has disproportionate impact on gender and sexual and reproductive health and rights of women and girls. There are a few mechanisms, like we have already discussed about that in the first presentation, particularly about the National Adaptation Plan and NAP and Health National Adaptation Plan. But these both document and other document also insufficiently mention about gender and sexual and reproductive health in their policies and plans. Thus, at the local level, there are some of the local governments which implements local adaptation plan of actions and integrating gender and SRHR. But there are nominal studies which aims to understand how the local government is implementing gender and SRHR into the climate policies. Thus, the objective of this study is to explore and analyze the ongoing initiative to integrate gender and SRHR within the climate policy and program. So I would like to start with the methodology. A cross-sectional qualitative thematic study as a study design was adopted. For the qualitative thematic study method, we have adopted to Brown and Clark. The study took place in the month of October 2022 in Kailali and Agakhachi district of the Sudur Paschim and Lumbini province respectively. Total of 14 participants participated in this study, out of which 12 participants were representative from local government, social mobilizers, from civil society organization, while 2 key informant interviews were taken with the technical experts from climate change and climate and health, and we achieved the data saturation with the last KII taken, and the data saturation for this study is adopted from the FUSETL. So regarding the data analysis, the recordings were transcribed verbatim in Nepali and then translated into English. Inductive coding approach was conducted using the Deduce software, and the codes were aggregated to form subthemes, and subthemes were aggregated to form themes. Latent analysis was conducted to interpret the underlying meaning of the qualitative data, and the findings are presented in the form of description and excerpts. We would also like to present the researchers' reflexibility, because IPAS Nepal is extensively working on integrating gender and climate in local adaptation plan of action and working on resilient health system as well. Thus, to limit the introduction of social desirability bias and other response bias as well as researchers' bias, independent enumerators were involved for the selection and the interviews of the participants. Total of 63 codes were developed. 5 sub-themes were developed and 2 themes were developed as a result. The first theme, integrating gender and SRHR in climate policies, has 3 subsequent sub-themes, which are impact of climate change, development of local adaptation plan of action, and implementation of local adaptation plan of action. Similarly, the second theme, continuity and sustainability of integrated climate programs, have 2 subsequent sub-themes, which are agency building and technical assistance, and resource allocation, forecasting and pooling, which we will be discussing in the upcoming slides. Theme 1, integrating gender and SRHR in climate policies. The first sub-theme under it is impact of climate change, and the participants have described the impact of climate change on gender roles, particularly the increased workload among women. They travel a long distance to fetch water, to collect grass, and to collect the firewoods. Similarly, they have also expressed the impact on sexual and reproductive health, particularly the disrupted access to essential sexual and reproductive health services, nutritious diet during menstruation, pregnancy and postpartum periods, destruction of health facilities due to landslides and floods, and pelvic organ prolapse, which is linked to the increased workload caused by the climate change. Similarly, there are also harmful gender norms and practices, particularly all forms of violences, chaupari, and early child marriage, which was also presented by Dhimal sir in the earlier plenary sessions as well. I would like to share one excerpt from a representative from CSO. For years, childbirth has been occurring on roads that are destroyed and washed away by floods. Additionally, elderly women in our areas have been suffering from uterine prolapse due to increased workload. The second sub-theme is LAPA development process, and this has been adopted from the Local Adaptation Plan of Action Framework 2019, and there are 6 steps, which majorly includes awareness raising and community sensitization on gender, SRHR and climate change, vulnerability and risk assessment, and profiling of disaster occurrence and reproductive health issues, prioritization, and inclusion in the annual budget, monitoring and evaluation mechanism of local government, and integration and mainstreaming of gender and SRHR into local level climate change adaptation, disaster risk reduction, and management strategies, plans, and policies. This is what the local government has followed the steps to integrate gender and SRHR in the local adaptation plan of action. And here is one picture from Dhangari sub-metropolitan city on how they have integrated gender and SRHR into the LAPA. So we have come up with the implementation of LAPA, which is the third theme for the first, third sub-theme for the first theme. And it has been mentioned in the table. There are like 12 cross-cutting areas and subsections, but we, for this presentation, we have selected 3. First one is agriculture and food security. For this, the participants highlighted the problems such as pest infestations and the travel long distance to collect firewoods, and for that, integrated pest management training and distribution of improved cooking stove to household was conducted. Similarly, for the disaster management and rescue, the problem identified was dysfunctional and lack of government structure to address integrated climate-induced disasters, and limited trained human resource for disaster management. For this, the interventions where community disaster management committees was formed, and basic disaster management training and community-based emergency response training was conducted. The third and major area was sexual and reproductive health services, where the problem identified was compromised access to sexual and reproductive health service for women and girls from climate risk areas. The intervention activities are medical abortion and implant training, distribution of medical abortion and family planning commodity, establishment of antenatal care room, establishment of community outreach health clinic along with gender-friendly toilet, and reproductive health camp, particularly during humanitarian crisis situation by the implementing municipality in support of development partners. I would go with another excerpt again. A lot of times we had to manage disaster right after it happened. After the integrated LAPA was developed, it helped us in pre-planning for disaster management. LAPA has helped in showing a sort of pathways for us and a guideline that helps us to move forward. We intend to work as guided by the integrated LAPA. Local level government has put it in the budget and policies to manage disasters and provide health services, including sexual and reproductive health. The excerpts by the healthcare provider. The theme 2 explains continuity and sustainability of integrated climate program, for which the first one is agency building and technical assistance. There are some of the local evidences generated at the local level, particularly on understanding the linkages between gender, SRHR, and climate change. And based on that, evidence-informed orientations were conducted together with the community stakeholders. And once the community were oriented, they were mobilized at the community level to enhance the demand generation for integrated policies and programs. Similarly, we have already talked about lots of user-centered design in yesterday as well, and similarly here there has been some co-creation approach throughout the LAPA development process and integration process, and there were also evidences of technical assistance from development partners, which has enabled the capacity of local government. I have felt that my knowledge regarding climate change and SRHR has increased. I have contributed to the development and implementation of LAPA social mobilizer. So the final sub-theme is resource allocation, forecasting, and pooling. We have already seen the arrays of the implementations and the interventions identified by the local government, and if the integrated LAPA is to be implemented and scaled up in other local government as well, there will be the need of resources. Thus, adequate resources allocation from the federal, provincial, and local government is essential for the intersectionality of the gender and SRHR in climate policies. One thing that has been consistent across the discussion today is the lack of coordinations between ministries and departments. The integration of climate change, gender, and SRHR is not an issue of one ministry or department. It involves many ministries and departments. Thus, interministerial and department coordination is key in prioritizing, continuation, and scale-up of integrated LAPA. Finally, one of the instrumental has been the cost-sharing modality that participants have shared, particularly from the development partners in implementing the integrated climate programs. I'll skip to respect the time. To conclude, we know that women and girls face multifaceted challenge, and the gender dynamics is compromised, while the access to SRS service and information is also compromised. We need evidences. We need to enhance the capacity. The capacity includes both skills and knowledge of community stakeholders, and we need to mobilize the community stakeholders if we want to integrate it. Adequate coordination and resource allocation is important for the intersectionality of the issues and for the scale-up and sustainability of integrated plans and programs. Two takeaway messages for the audience is LAPA is an entry point to integrate gender and SRHR in climate policies. And the final one is user-centered approach, local ownership, and cost-sharing modality helps to facilitate, integrate, and scale up of gender and SRHR in climate policies and programs. We would like to acknowledge the participants, the local government, for the support during the study. These are the references used during the study, and thank you.
Thank you.